Hey there, viewers! Weird question. Have you ever tried Botox? Are you thinking of getting Botox to decrease signs of aging? Botox is an injectable wonder drug, one that magically wipes away all wrinkles, crow's feet, and fine lines. Actress Nicole Kidman admits to getting it frequently. But not everyone is as lucky as her. Botox injections can have side effects. Some people report having their face almost paralyzed. Today we'll be talking about the 5 common side effects of Botox injections. Do you get droopy eyebrows? Dry eyes? Can Botox injections hurt your eyesight? Are any of these effects long-term? We're talking all that and more. Number 1. Minor side effects. The good thing about Botox injections is that they're considered one of the safest cosmetic and corrective procedures. The majority of side effects caused by Botox injections are temporary. They fade away within days or last just as long as the Botox treatment itself, which is 3 to 6 months. In fact, from 1989 to 2003, only 36 adverse cases of Botox injections used as cosmetics have been reported to the US Food and Drug Administration. And 13 of these cases were triggered by an underlying condition other than Botox. Minor side effects caused by Botox include bruising, pain, or swelling at the injection site. You may also experience a fever. Botox injections can cause headaches, and don't be surprised if you get cold flashes either. To avoid these minor side effects, follow your doctor's pre- and post-injection instructions. Tell them all about the medications and supplements you're taking. If you're afraid of side effects, you may want to sit out on your friend's next Botox party. Number 2. Dry eyes and droopy eyelids. Experts claim that when Botox is injected around the Orbicularis muscle, it can cause dry eyes. Orbicularis muscles are responsible for the opening and closing of the eyelids. Due to the inability to close eyelids completely, you may experience dry eyes. If this happens, you can use eye drops and ointments. You may have to wait for the Botox effect to wear off on its own. To avoid the dry eye problem, experts generally administer Botox injections between the eyebrows. A good doctor will try not to eliminate all functions laterally. Another problem associated with eye Botox is droopy eyelids. There are 2 reasons you might experience this. In case you got Botox in the forehead, the injection might cause your eyebrows to descend. Those descended eyebrows make them appear droopy. Droopy eyes can also happen when Botox is used between the eyes or just over the brow. Are you enjoying this list so far? This next point will surely surprise you, but before we continue, why not subscribe to our channel for more videos and hit the bell icon so you're always up to date. Number 3. Excessive tearing. While Botox is a common corrective procedure for people with teary eyes, it can have the opposite effect as well. Botox injections might spread a little beyond the injection site. For this reason, a small, highly concentrated Botox dose may be used when working near the eyes. Large diluted doses have a higher risk of spreading. Allergic reactions to Botox can sometimes cause excessive tearing. You may experience teary eyes along with blurred or double vision, as well as impaired vision. Unqualified practitioners administering Botox injections put you at a much higher risk of eye problems. To avoid this, always seek out a professional. An expert is your best bet. Number 4. Uneven eyebrows. These are among the most hated of side effects. After all, who wants to wear a surprised expression every waking minute? I would hate it too if I ended up looking like Cruella de Vil from 101 Dalmatians after a botched Botox procedure. Why does this happen? Let me explain. Our eyebrows have fan-shaped muscles beneath them called corrugators. The muscles in the forehead, where lines appear, are called frontalis. When you're worried about signs of aging in these areas, the doctor gives you a Botox injection to smooth out the muscles. The result is a youthful appearance. However, there are chances that the corrugators and frontalis receive Botox injections, and one side may be slightly more impacted than the other. This results in uneven eyebrows. The good news is that the effect lasts as long as the Botox does. As the effects wear off, so will those uneven eyebrows, and thankfully the look of surprise will disappear too. Before we move on, here's a video you may like. Are your wrinkles trying to say something about your health? Check out our clip on the subject. Number 5. Botulism-Like Symptoms. If used for cosmetic or corrective procedures, Botox can cause botulism-like symptoms. Botox is made from a toxin. This toxin is produced by bacteria, which causes a life-threatening condition called botulism. Usually, botulism occurs when adults eat food contaminated by bacteria or have a wound infected by bacterium that lives in soil. Children can get it when they ingest infected soil. It's often a life-threatening medical emergency. However, Botox injections use this toxin in very small quantities. This same toxin paralyzes or weakens the targeted muscles and blocks certain nerves. Like every other procedure, there is a risk that you'll develop complications. In this case, botulism-like symptoms. These symptoms include difficulty swallowing, speaking and breathing, vision problems, general weakness, loss of bladder control, dry mouth, headache and dizziness, and difficulty sleeping. An analysis of the botulism patients caused by Botox found that these symptoms usually occurred within 0 to 36 days of receiving injections. Although rare, this is a serious reaction and you need to speak to a doctor immediately. Long-term effects. So far, we've learned about the temporary effects of Botox. Most of these symptoms fade away within days. But are there long-term side effects? If you're getting Botox injections for the first time, the chances of long-term side effects are very low. However, people who get this procedure frequently may see these effects last for longer periods. One study focused on 45 patients who received Botox injections over the course of 12 years. 20 cases of adverse reactions were reported during this time. These reactions include blurred vision, dizziness, neck weakness, vomiting, and difficulty swallowing. Some even experienced heart palpitations, edema, and hoarseness. The best way to avoid side effects is to work with a licensed medical practitioner. It's not worth sporting eyebrows that make you look like Ursula from The Little Mermaid. Have you ever had Botox injections? Will you think twice about getting them after watching this video? Let us know in the comments below. We love hearing from you. Enjoyed this video? Hit like, share, and subscribe to Bestie. Wait, what kind of bestie are we if we don't tell you about our other awesome videos? Go ahead, choose the left or right video, and enjoy.